just realized it's kind of loud. Okay, wow, it's like. Oh, that's better. I'm trying to get my YouTube thing. Oh, there we go. There we go. I'm tired. My sweater smells so good. Okay, my goal is to find all of my reviews from class, like all of the worksheets. Like this is chapter 13, 14. But I have to find all of them so that we can use them to review. I think this is 11 and 12. This one doesn't say 12 on it though. But I think I remember it being number 12, chapter 12. Here's 9 and 10. And this is also for chapter 9. Great chef today, Sunday. Why am I in my office working? I don't know. Why are you in your office working? You gotta get your work done, right? Okay. Some of these don't say what chapter they're from, which is gonna be annoying. Oh, I can look at, I can look at my canvas. Because grad school is pain. True. I mean, I wouldn't know. Oh, my fucking computer's going so slow today. Chapter 8. What's this one then? 7? I don't know, or is it just a bonus one? Certificate petition. chapter 3. Why did I jump to chapter 3? Chapter 3 is chapter 4. Where's chapter 6 and 5? Did we not have one those days? Maybe it's these ones. Chapters 1 and 2. I'm confused. I'm confused. Where is it? I didn't toss anything. I guess that's it. Okay, so we have chapters 1 and 2. Chapter 3. Chapter 4. And this unknown one. I'm trying to check which one it is. It might be chapter 5 or 6 or 7. 5, 6, or 7. But I'm missing 5, 6, and 7. Probably 7. Oh, it's because I fucking wasn't there for chapter 5 and 6. This must be chapter 7. It doesn't seem like they had one, though. They just had blood flow through the heart and the skin. Well, I'm gonna put this one here. And then just go through all of these. My goal today is to get through all these worksheets. I'll probably go through the first 7. Even though 5 and 6 are missing. I'll go through 7 through 8. I'll go through 8. And then the rest will be 11, 12, 13, and 14. And we'll take a break before doing the second half. Oh my god. Okay. Yeah, this is gonna be hard. I haven't looked at chapter 1 in a long time. It's okay. An intentional harmful act or use of force without consent or illegal justification. That's battery. A hair on my face. Federal law that established standards. Oh, I should look through these first before I try to guess all of them. Okay, so this department, microbiology, this department in the lab analyzes blood and other bodily fluids for presence of microorganisms like bacteria, fungus, and parasites. That's microbiology. Proxemics is the study of an individual's concept of and use of space. Excuse me. Negligence, the failure to exercise due care, the level of care that a person under these circumstances would do. NPSGs, to identify patients correctly, improve staff communication, and reconnected. Jesus Christ. Why did it disconnect just like real quick? Oh, silly. I'm doing it intermittently for like 5. It's doing it intermittently for like 0.5 seconds? Oh, that's weird. It seems fine now, but I don't know. The heck? What's up with it today? Don't like it. Hearing loss is an example of a barrier to effective communication. Delta check compares current results of a lab test with previous results for the same lab test on the same patient. Res ipsa loquitur. Thing speaks for itself. Tertiary care is highly specialized medical care that involves advanced and complex procedures. The chest speaks for itself. Why chess? Medicare is a medical insurance program that primarily serves people over the age 35 and certain younger people who are disabled or on dialysis. CQI, a system put in place to improve quality by continuously monitoring and analyzing and identifying things that need improvement. The chess speaks for itself is a famous phrase? Oh. Interesting. What does it mean? Chemistry, the department in the lab that measures toxicology, therapeutic drug levels, and electrolytes. CAP. Offers proficiency testing and a continuous form of laboratory inspection by a team made up of pathologists and laboratory professionals. MLS has a bachelor's degree plus additional studies and experience in a clinical lab setting. MLS. Implied consent. A patient's actions or circumstances imply without a verbal or written expression of consent. CLSI. A global non-profit standard developing organization to develop clinical and laboratory practices and promote their use worldwide. Leah 88. You know, American GM Hans Niemann said it when accused by GM Magnus Carlsen. It was a whole thing. Oh, interesting. Do you know Magnus? No. Sorry. I do not. Leah 88, a federal law that established standards that apply to all clinical laboratories. Battery. An intentional harmful act or use of force without consent or legal justification. Oh, Magnus is the best player in the world, kinda? Why kinda? Okay, now let's see if I can memorize all of them. An intentional harmful act or use of force without consent or legal justification is battery. A federal law that established standards that apply to all clinical laboratories. Leah 88. Global non-profit standard developing organization to develop clinical and laboratory practices to promote these worldwide. CLSI? Okay. Patient's actions or circumstances imply without a verbal or written expression of consent. Implied consent. Has a bachelor's degree plus additional studies and experience in a clinical lab setting. MLS. Offers proficiency testing and continuous form of laboratory inspection by a team made up of pathologists and laboratory professionals. CAP? Yeah. The department in the lab that measures toxicology, therapeutic drug levels, and electrolytes. Chemistry. A system put in place to improve quality by continuously monitoring, analyzing, and identifying things that need improvement. He stepped down from world champion? Aw, dang. Is he like retired? Or I don't know what step down means exactly. I don't know this one. CQI. CQI. Just remember Q is for quality. I don't know if that's actually what it stands for. It probably does, but... No, he just said he would let someone else have the title? Oh. Dang. That's so weird that you can just do that. A medical insurance program that primarily serves people over age 65 and certain younger people who are disabled or on dialysis. That's Medicare. It's highly specialized medical care that involves advanced and complex procedures. That's tertiary care. The thing speaks for itself. Res ipsa loquitur. Compares current results of a lab test with previous results for the same test on the same patient. Delta check. Is an example of a barrier to effective communication. Hearing loss. Requires all healthcare providers to obtain a patient's consent in writing before disclosing medical information like test results. That's HIPAA. Independent, not-for-profit organization establishing standards for the operation of hospitals and services. I don't remember. Oh, the Joint Commission. The practice of drawing blood from a vein or through a cut in the skin. Phlebotomy. To identify patients correctly, improve staff communication, and prevent infection. And NPSGs? Yes. The failure to exercise due care, the level of care that a person under these circumstances would do. That's negligence. It's the study of an individual's concept and use of space. Proxemics. Its department in the lab analyzes blood and other bodily fluids for presence of microorganisms like bacteria, fungus, and parasites. That's microbiology. Okay. That's chapter 1 and 2 done. I think I did pretty good for those. Memorizing specific test answers seems like an odd way to do it. I'm like memorizing definitions right now, basically. This isn't like... This is like... Well, they're not like definitions. They're like things that describe them, or like ways that they would be described in the test, according to the professor. She said that if you do the questions like in the book, like the ones that I've been doing as practice, and if you study these worksheets, then you should be fine for the test and for the exam. Other instances of impairing communication. Yeah, I know that, but like it gets you to think about like that as a test question. You know what I'm saying? Like, obviously when I say hearing loss, I'm not only thinking about hearing loss. I'm thinking about things like, oh, they might be blind, or they might be really old, or they might like be like losing their, not like sentience. What's the when they get old and they aren't able to communicate as well because they're old, or when they have like a hearing, or I mean not like a hearing, a language barrier, or like things like that. Like, it just gets me to think about those other things too. Even though on this paper it only has a hearing loss. Like, I'm not only thinking about hearing loss here. And like these, like the CAP, CLSI, HIPAA, things like that. Like there's more to them than what was stated here. Senile dementia. Yeah, senile, that's the word I was thinking. But yeah. Basically, I find that's so funny. Oh my god. This one's harder to cover up because it's like written weird. Can't really like test myself on this one. I'll just read through them. That's fine. Old person syndrome. Is that a thing? Probably not. Universal precautions was initiated by the CDC as an infection control policy to maintain that all blood and bodily fluids are considered potentially infectious. Protective or reverse isolation is used for patients who are highly susceptible to infection. This is all kind of easy stuff, so I'm not like super worried about memorizing all of it. Susceptible host is someone with a decreased ability to fight infection. Hand hygiene is one of the most effective ways to preventing the spread of infection. MRSA? I don't know. Oh my god. Yeah, it's where they're fucking old. What the hell? Calm down. MRSA is the most commonly identified antibiotic-resistant pathogen in the world, according to the CDC. It's a pathogen. I underlined that. HBV, I forgot what that stands for, but HBV is the most frequently occurring lab-acquired infection and a major occupational hazard in healthcare. Lab-acquired infection. Hi, Chef. Hope you've been doing well. Hey, Ice Lava. It's been a while. I'm studying. I have my 3 big exams coming up, so I'm stressed out. I'm studying for them. It's gonna be okay, though. We're gonna get through it. I hope I do okay. Airborne transmission involves microbes that can continue to float in the air and can be inhaled long after the infectious person has generated them has gone. CDC is charged with the investigation and control of various diseases, especially those that are communicable and have epidemic potential. Interesting. HLS or HCS? I wrote that weird. HCS was developed by OSHA to protect employees who may be exposed to hazardous chemicals and is also known as the Right to Know Law. HCS is the Right to Know Law. Employers are required to obtain the SDS of every chemical present in the workplace. That's the, I forgot what it stands for, but it's like a paper that tells you about the chemical that's in the thing that you're using. Like whether it's hazardous, whether it would be cancerous to you. Studying hard so I know you'll smash the exams. You'll do amazing on the exams. Thank you. I hope so. I'm really hoping so. I'm trying my best here. I'm scared. I'm scared a lot. When providing first aid to a victim of shock, it is most important to maintain an open airway. Maintain an open airway. That's so important. My ex used to snap. Axelor! Axelor, calm down! Oh, sorry, I got hacked. Didn't mean to type that. Ay, ay, ay. Excuse me. Uncontrolled bleeding can lead to hypovolemia and hypovolemic shock, which can quickly result in death if left untreated. The CLSI Clinical Lab Safety Guidelines states that safety showers and eye wash stations should be within a 10-second walk from all locations in which hazardous chemicals or infectious materials are used. You should never eat, drink, smoke, chew gum in the laboratory. This is all like safety stuff. Skin or wound infections that cannot be covered require contact precaution. Neutrophil is a type of white blood cell with its major function to engulf and destroy pathogens. Aseptic technique is a healthcare practice used to reduce microbial contamination with the goal of protecting patients from infection and preventing the spread of infection. Wearing gloves during phlebotomy procedures is mandated by the OSHA bloodborne pathogen standard. Class K fires occur with high temperature cooking oils, grease, or fats. Anything harmful or potentially harmful to health is called a biohazard. Deep breathing is an easy way to reduce stress in the moment and has a positive effect on the nervous system and relaxes the body. I need to remember the different types of fires. There's this, I think there's class A, B, C, D, and K, I want to say. I have it written in here somewhere. Yeah, it's A, B, C, D, K. Class A is ordinary fires. Class B is flammable liquid. Class C is electrical fires. Class D is combustible metals. And Class K is cooking fat, oils, and fats is kitchen. So like kitchen fires. I'm gonna have to remember that also. Ordinary fires. A. Ordinary fires. B. Flammable liquid. C. Electrical fires. D. Combustible metals. K. Cooking oils and gases. Oh my god. Oh my god, roots and fucking prefixes, roots and suffixes. That's the next one. I don't wanna. I hate it. I hate memorization. Okay. Medical terms. Okay. Tachy is too fast. Brady is too slow. Hypoxia is inadequate supply of oxygen. No apnea is no spontaneous respiration. Meter is measure. Hypoglycemia is low blood glucose level. Hypoglycemia. Pathy is disease. Myo is muscle. Hepatic is referring to the liver. Analgesic is something that removes pain. And cardiomegaly is enlarged heart. Memorization is for the birds. Yeah, it's not for me. I hate memorization. Okay, and then I have another set of words that I should probably go over. Okay, so these are all word roots. There's cardi, which means heart. Nepher means kidney or renal. Myo means muscle. Pulmon means lungs. Thorax means chest. Thermia means heat. As in UR, means urine. Emesis or mesis, I don't know how you pronounce it, is vomit. Altes means pain. Hemo is blood or bleeding. Chondro is cartilage. Gastro is stomach. Sinus is cavity, channel, or hollow space. Nia is breathing. And dips is thirst. This is all just reminder, like, because I've already memorized these before, so it's kind of just reminding me what they are, but it still feels like memorization. Tachy is fast, Brady is slow, hyper is too much, hypo is too little, A is none, dis is difficult or painful, hemi is half, peri is surrounding, poly is many, multi is many, uni is one, primi is one or first, bi is two, diplo is also two, tri is three, and null is none. And then for suffixes, we got pathy, disease, stasis, inactivity, still or stopping, itis is inflammation, ic is pertaining to, al is pertaining to, la is condition of, ectomy is surgical removal of, logi is study of, I don't know why I said it like that, logist is specialist, megaly is enlargement, meter is measuring instrument, oma is tumor, synthesis is puncturing an organ or body cavity, and phasia is eating or swallowing. Jesus Christ. That's a lot of words. It's a whole page. I'm gonna go over all these again before the I don't know, before my final and before my exam, my NHA exam. Okay. Oh my god. What is the test? What is the tube needed for draw? What's the additive and what's the order of draw? Okay, well that's easy. Honestly, like, I mean, that's not easy, but I'm talking about the order of draw. Because, like, as long as you know, what was I gonna say? I'll catch you again another time, Chef. Kill it on your exams. Thank you. Sorry that I'm just studying today. And thank you for dropping in. When I was at my externship, I got really used to the order of draw, so that kind of helps with memorizing this. Like, what is the test? What is the tube needed for the draw? What's the additive? What's the order of draw? And I am going to have to memorize some of these because it's going to ask me about specific tests. I already know it is. CBC is complete blood count. You use a lavender top tube. Liquid is... I don't need to know the additive. I do need to know the additive. A3 EDTA. PT is prothrombin time, completely filled blue top, buffered sodium citrate. Lead is PB. Royal blue EDTA. You use a tan top, lead free. Spot activator, classic serum. Blood culture is aerobic and anaerobic tubes, but you draw the aerobic first. Because it's okay for that one to have air in it. Ammonia is NH3. Use a green top tube, and it has sodium heparin. Must be placed on ice. Ammonia must be placed on ice. Copper, CU level, royal blue, spot activator. Excuse me, I burped. Glucose FBS, gel barrier tube, gray top, fasted. Yes. Bilirubin is also known as Billy. Gel barrier tube, which is a a gold top or red top or yellow. Wrapped in foil. For bilirubin, you have to wrap it in foil. What is a stat test versus ASAP test versus routine test? Give an example of each. Stat is immediately, ASAP is as soon as possible, routine is last priority. NPO, nothing by mouth. Can you always interrupt a physician or clergyman when a test is ordered? Why or why not? Only if the draw is stat, because the time with the clergy is private and limited. What is the most important step before you draw blood? Patient identification. Can you wake a sleeping patient to draw blood? Yes, but do it gently. Wake the fuck up! I need to get your blood! Imagine. What do you do when the patient is unable to participate in the identification process when they are unconscious? Ask relative, patient's nurse, other dedicated healthcare provider. Infant, ask the nurse, relative, or guardian. Mentally incompetent, healthcare provider, attendant, relative, or friend. Language barrier, healthcare provider, attendant, relative, or friend. This is basically all the same answer. Just like ask someone else. What's the best way to clean a site? 70% isopropyl alcohol pad, back and forth friction, 2-3 inches in diameter around the site. Back and forth superior to circular motion. Even though when I was at my ex used to wake me up not gently. Oh my god. Are you okay? But it says back and forth superior to circular motion. But when I was at my externship, they always wanted me to do it in a circular motion. I'm just like, throw everything I read in the book out the window, I guess. No, not really. Why do you ask? Because it didn't seem like you were, but now I'm sure. What are the best ways for blood draws on children under 2 years old? What are 3 ways to help drawing blood on kids? Superficial veins, AC, fossa, forearm. What is iatrogenic anemia in children and infants? How does this affect the phlebotomist's job? From repeated blood draws, dropping hemoglobin and hematocrit levels, we are the ones taking blood repeatedly, so we might be the ones to notice it. What can you do to help a blood draw be successful in a geriatric patient with hearing loss? Speak clearly, don't shout, confirm information. Arthritis, let the patient decide a comfortable position. Dementia, communicate through a relative or caregiver. Sagging skin, might be harder to anchor the skin to keep vein from rolling, so they said you can grab the skin from behind the elbow to anchor. which it seems kind of weird, but I'll try it if I ever need to. I haven't needed to. A lot of my patients that I did at my externship were seniors, but they didn't really have like too bad of skin to work with. Like they always like tell you that like, oh, they have sagging skin, it's gonna be hard, but like it wasn't really that bad. If anything, the seniors were easier because they usually had way easier to see veins. There's a lot of old people. There's a lot of old people. Period. Especially when going to the doctor. You know, you go to the doctor a lot more. You get blood draws done a lot more when you're older. Because you're, like, checking on levels and things like that. My veins are really easy to see. Ooh. Mine are difficult. They always have to go for the basilic vein, which is one that you're not, like, typically supposed to go for. But they always have to go for that on mine. People often comment on how veiny I am. Because I have no skin pigmentation. Oh, so it just like shines like the light of day. You know what I'm saying? It stands out. In a wheelchair, lock wheels assist, but do not lift a patient from the chair. Never lift a patient from the chair. That's not my— first of all, that's not my job. Second of all, that's a liability. Okay. 11:11. It's 11:11. Everyone make a wish. I made a good wish. Okay. I made a wish. Yeah, even though it's not 11. It's technically not 11:11 for you, but it's 11:11 over here, so you can make it. Okay, before we move on to... I want to take a break before moving on to the... do I need a break? I probably should take a break. We've been going for like 45 minutes. So before I go on to chapters 9 through 14... 211 counts? Nice. Yes, I agree. I have so many notifications that I don't feel like dealing with right now. I did get my refund for my ski pants. So, it's all good. Got like $100 back. $100-something. I guess because of tax or because of shipping or something? I don't know. Excuse me. I wish I had at least tried them on. I'm sad. Oh well, it's okay. You know Bill Thurston's method of turning a sphere inside out? Yes. Wait, what? Bill Thurston? Isn't that the same person? I'm too warm, but I'm too grody to wear new clothes. You know what I'm saying? Great video. Ay ay ay. Okay. I want my paycheck so I can get the things that I need to get. But it's probably gonna be a small ass paycheck. I still have to pay my mom for my I pay my mom for my car stuff. I'm sweating. I don't know whether or not to tell. Never mind. I don't know. I'll figure it out. I'm looking at my onesie that I want to get. I really hope it's all I've dreaming more. This is all I can think about. Is this onesie. I'd be cracking my back. Okay, that's enough of a break, I guess. I don't know. We have to go back into it. Back into it. Then we can be done. We have like one for chapter 9, and then that's one that's on chapter 9 and 10. You know what? I don't care about this one. I don't care about chapter 9. I don't care about chapter 9. I really don't. We're gonna skip to chapter 9 for now. We're just gonna do the chapter 9 and 10 one. Which is gonna be hard to read through, but it's okay. Okay, basal state is resting metabolic state in the body in the morning after fasting. Capillary puncture is a practical alternative when small amounts of blood are acceptable for testing. Nerve injury is a burning or electric shock sensation, numbness in the arm, and pain radiating up the arm. Kernicterus, a brain dysfunction caused by toxic levels of bilirubin. 18. Microtubes. Collection containers used to collect tiny amounts of blood from capillary puncture. Mastectomy. Never draw blood from the safe side of this. Cardiac arrest can occur in an infant if more than 10% of their blood volume is removed. Hematoma formation indicates that an artery has been accidentally hit. Parent is the best resource to assist you with the blood draw on a young child. Which one is not? Chapter 9? It says, how do these physiological variables affect lab results? What test or tests can be altered? And it has things like age, altitude, dehydration, exercise, jaundice, and pregnancy. And then it says, how can problem sites affect the blood draw? What's important for the phlebotomist to know? And then it's like burns and tattoos, sclerosed veins, edema, mastectomy, paralysis. And then how should the phlebotomist deal with these potential possible complications? Things like syncope, specimen contamination, nausea, vomiting, seizure, excessive bleeding, hemoconcentration, inadvertent arterial puncture, a tube that won't fill, or nerve injury. It's just like, oh, how do you problem solve? Like, what should you keep in mind, and how do you problem solve? It's like not that deep. So it just feels weird to like obsess over that one. Feather, the thinnest area of a properly made blood smear. I like making blood smears. NBS, state-mandated testing of newborns to detect genetic, metabolic, hormonal, or functional disorder. NBS. Newborn. Ugh. Tube vacuum is a common reason why the blood doesn't fill. Therefore, try a new tube before giving up on the draw. I did have that problem twice when I was at my externship, where the tube didn't fill, so I had to get a new tube. 21. 2 millimeters depth of a capillary heel puncture on a newborn with adequate blood flow without risking injury. Bandages are a choking hazard for infants and children under 2 years old. 16. Iatrogenic anemia. Primary reason for blood transfusion in a neonate. Syncope. If this happens, you must immediately discontinue the draw to help prevent the patient from injury. Direct pressure is usually needed when someone is on an anticoagulant. Draw blood from IV. One of the most common procedural errors that can cause hemolysis. AV fistula is a dialysis access that connects the artery and vein and can never be used for venipuncture. Crying infant can cause false increase in white blood cell count, which is very strange to me. If an infant is crying, it can cause an increase in white blood cell count. A false increase. Finger stick can be performed on an adult and child over the age of 1 year old. Pre-analytical phase begins when the test is ordered and ends when the testing begins. VADs, only nurses and other trained staff can access this for a blood draw. VADs. Coban should be used when there is an adhesive allergy. Potassium. Pumping your fist during venipuncture erroneously increases this. Glucose is normally higher in capillary blood specimens. PKU is a genetic disorder characterized by a defect in the enzyme that breaks down proline phenylalanine, causing brain damage. Phenylalanine? That's a weird word. When I cry, it doesn't increase my white cell blood count. My ex used to make me increase the white cell blood count. Hello, everybody. Hey, Rock God, how are you? Excellent. Jaundice is a condition characterized by increased bilirubin in the blood. Altitude decreases oxygen levels, causing the body to produce more red blood cells to meet the body's oxygen needs. Okay. That one was pretty easy. I kind of remember all of that. Don't need to worry about it. I'm back. Me too. We're all back. We're all back here again. Hypoxia. That means your body or your blood isn't getting enough oxygen. I think. Something like that. That's correct, Chef? Yay! Okay, I'm gonna do chapter 11. Aerobic. Should be filled first when drawing cultures. Bacteremia is a blood infection and typically blood cultures are ordered at this time. Number 2. Cell salvaging, a medical procedure designed to recover blood loss during a surgery. Lavender, pink top EDTA, or plain red tube, required for blood bank tests. DDM, testing of drug levels in the bloodstream. That drug. Blood donor eligibility. Must be in good health, feel well, and at least 17 years old and weigh 110 pounds. GTT, a test to diagnose problems with carbohydrate metabolism and must be stopped if patient vomits in first hour. Lactate is usually present in the blood when a patient is in septic shock. OGTT, a glucose screening test for pregnant women. Polycythemia, a disease where therapeutic phlebotomy is used. Peak and trough are both time tests drawn to ensure proper drug dosing. Chain of custody must be followed when collecting forensic specimens. HCT is the measure of the volume of red blood cells in the blood. 20 mL is the amount of blood needed for a set of blood cultures in an adult. HCG is the pregnancy hormone. Look back is the process to trace and test blood donors and recipients in case of contamination. 16 to 18 gauge, typically used for blood donation. 2-hour postprandial is a good test to be done to screen for diabetes or monitor insulin therapy. Discard tube is typically used before drawing a light blue top. BZK used when drawing a legal blood draw. That's a type of cleaner. Potassium, abnormal level in the body can cause death for potassium. Sorry. Okay. This is the one that I also have a exam on. Chapter 13 and 14. Because I have my final exam, which is on everything, but then I also have my chapter 13-14 exam that I was supposed to take last week, but I was at my extra. So I have to memorize these ones. Not memorize, but like understand these ones. Or radial artery. Or hold on. Arteriospasm is a common condition with needle penetration that can make it difficult to obtain a specialist. Bone marrow is aspirated and used to detect and identify blood disease. Thrombus can occur when there is an injury to the inner wall of the artery and can impair circulation. Ketones are present when the body breaks down fat for energy because the body cannot metabolize glucose properly. 8-hour specimen is the ideal specimen because it is the most concentrated. Sweat is used to diagnose cystic fibrosis. Patient activity and position. Is typically required information for an ABG. 210 pounds is also known as 95.5 pigs. Radial artery is easy to palpate and has a reduced risk of damaging a nerve. "30 to 45-degree angle is the proper technique used to obtain an ABG, stopping when you see a flash of blood. 20 to 30 minutes is called the steady state needed before drawing an ABG. UA includes physical, chemical, and microscopic analysis. Brachial artery has the increased risk of hematoma formation. Copernized syringe kit must be used to prevent errors such as clotting or acidosis. 5-HIAA is a product of the breakdown of serotonin that is measured in the diagnosis of a tumor. Hair is best for DNA analysis and must include the root. Semen is collected to assess fertility. WIAC is typically performed with a smear of feces placed on a test card, and if the card turns blue, it is positive for blood in the slit. Femoral artery might be the only place possible to get blood if someone is hypovolemic or have low cardiac output. Spinal fluid is collected via lumbar puncture and used to diagnose meningitis. AFB is the microbe that causes tuberculosis. Seaman? Seaman? What did you say? Seaman? This is not a good food discussion. Oh, sorry. I mentioned a few things that aren't good for food discussions, for eating discussions. Okay, so that's all for all of the chapters. We've been studying for about an hour. I put them all in here. Okay. I've finished my studying for today. I might study again today, later. We'll see though. Just because I want to be really prepared for this. But anyway, I don't know what to do or what to play now. We could play Tears of the Kingdom. We haven't played that in a while. I feel like I would just end up looking for shrines though. I just want my paycheck. What would make you happy to play? I don't know. What do I even do with my life anymore? Oh, you know what? I was supposed to watch the JJK episode today. Oh, chef. Rika? No. I don't know what that is. Kaisen? Ah! I have not watched the newest episodes, so don't spoil it if you have. How do you feel? Kind of like meh right now. I don't know. I just feel like I don't know. You know what I mean? GTA 6 leak? What are you talking about? GTA 6? I'm gonna clear off my notifications real quick. Because it's gonna bother me. Okay. I'm dancing. GTA. Mm-hmm. Don't show it on stream. Oh, okay. They're copywriting? Oh, okay. No problem. We'll just look at my onesie. I'll watch it on my own. Nice pajamas. Yes, nice pajamas. I can't wait for my paycheck so I can get it. Let me. I don't know what to do anymore. I feel like I'm like maybe I'm like burning myself out streaming this much. But I don't even know what I would do if I'd like stop streaming. Like what I would do with my day. I would like to go out and do something, but I'm broke right now. No, I'm not gonna quit streaming. I might like stop doing it every day. Especially because I'm gonna be working. I probably won't stream the next couple days unless I stream myself just studying. But I might just like study on my own. I don't know. We'll see. Because I have work. Uh, hold on. Do I have work on Tuesday? No, I don't. But I do have a therapy appointment. Ugh, it's gonna be rough, man. It's gonna be a next rough week and a half. But it's okay. I'm gonna make it through it. I'm gonna make it through it. I just don't know what to do now. Like, I could play games, but I just, like, not in the mood. I'm not in the mood to do anything right now. And I'm not even tired, like, so taking a nap is not even an option. You could play chess? What the heck? Why would I play chess? I'm not good at chess. I'm terrible at chess. Let's play Suika? What is that? What is Suika? Let's play chess. Cheese. Whoever wins. That's part of the fun. Being bad at it is part of the fun? I don't think so. I like being good at stuff. Here's how my week is looking. What did I do this morning? I got up almost 9 and I did my dishes. And then I was cleaning. What was I doing? Oh yeah, I was cleaning. I knew I was cleaning, but I forgot what I was cleaning. Nightbot. Hi, Nightbot. My face is turning all red. What is this? Bump them into each other. Ah, it's too small. No! You're back? Okay. I'm invested. What is happening? Oh shit. Oh, it didn't even do anything. The heck is a decoupon? Whoa. Damn it. I know it comes right after I cover one up. You're good at this. You must be a latent player. Big explosion. True. I am a latent player, just so you know. What the heck? There we go. Nice. Okay. the heck? Free connection. What the? I didn't do that. What the? Wasn't letting me drag them. We're back. We're back. Do not worry. Oh my god. Oh, it's still going. Okay. I'm back. Nice. Welcome back. Are you playing this game? Yeah, it's kind of silly. Why is this one rolling? Yeah, you're pretty good. Must be a latent play. Shut the fuck up. Oh no, things are getting tight. Oh no. Oh no! No! Jeff tells her viewers to shut the fuck up. She hates her viewers. I'm just... Because you said the same thing as fucking a rap god player. I ate taquitos for breakfast. And now I want more. This is the web version? Is it normally like an app or something? Seems like an app. It's a $2 game on the Nintendo eShop? That's all funny. Really addictive? Yeah, it seemed like it could get addicting. That's cute. Probably won't play it again today, but it was cute. Dang, look at these high scores. I'm nowhere near that. How did they do it? How did they do it? Keep splitting my bangs down the middle. They're like, if I don't wash my, like I'm in between hair washes right now, and my bangs tend to fall flatter on my face, which means they're longer, so they're poking me in the eye. We probably won't play it ever again. That's cute. I mean, I don't know. Is this how many points they're worth? Ah. Okay. I just don't know what to do with my day today. What's the weather like? Mostly cloudy. Low 60s. What is there to do? Thinking. I don't know. I feel like I shouldn't stream right now because I also don't feel like playing a game. But I just don't know what I'm gonna do if I stop streaming. That's the only problem. Just chatting. Just sleeping. More like just sleeping. Jeez. I haven't slept in the past couple days. And I didn't even fall asleep, okay? I never actually fell asleep. I just closed my eyes for too long. You can work on a programming project. I don't know programming well enough. Especially when I need more developers for. I would be of zero help. You can go window shopping. That's kind of boring when you don't have money. It's fun window shopping if you have money, because then if you want something, you can buy it. But if you don't have money, then you know you're just there to look at stuff. It feels kind of fun. And the other programmers could train you. That would take I don't have time for that right now. I do not have time for that right now. I have other things that I need to use my brain for. Don't have time for that. I don't have the brain capacity for that right now. Okay? It's like I'm using all of my brain capacity to help for me remember the stuff for my exam and stuff. I don't have the room in my brain right now for learning how to program. Just not possible. I'm not smart enough for that. Okay? I can't learn more than one subject at once anymore. After your exam then? Okay. Okay. What the heck? Oh no. You have to wait a week and a half. I don't know if you're gonna have time, because I have my 2 exams this week, and then I have 1 exam next week. I don't know if you're still gonna need something at that time. But the 1 exam next week is the most important one. I have a lot of time. I don't know, man. I don't know if I'm gonna want to. I'm gonna want to like take a break from using my brain a little bit. I don't know if I'm gonna want to use my brain. I'm so looking forward to not using my brain. Okay, in a week and a half. It's so close. I'm so close. I'm almost there. I love how Chef doesn't know how to say no. I'm bad at saying no. See? Okay. Yo! Hello, King Jong-un. Kim Jong-un is in my YouTube chat. I could read one of my books. I do have one that I haven't. A video. My sister's addicted to Hogwarts Legacy. Which one? My little sister. But all three of us like Harry Potter. My youngest one, the fourth one, she's not super interested in Harry Potter, but the three of us older ones love Harry Potter. So, makes sense why she would be addicted to it. It's fun though. I don't know if I want to play it because I just like I'm also really I'm right before a trial right now, so I don't know if I want to go into that. I also kind of want to get the console version instead. But if I did, I would rather get a physical copy, not because I don't have any room on it. Do they have it for the PS4 or just the PS5? What's the incentive to the console version? The controls are better for the controller, but whenever I try to connect my controller for that game specifically, it doesn't work. I don't know why. I can't get it to work. I've tried everything. Stop buying digital copies makes me mad. I know, I'm sorry, I'm lazy. It's easier to buy digital copies. How many digital games do you have for your console? For my PS4? At least 6, but probably more than that. I can't remember. I've just fell to my knees and target 6 is a big number. Yeah, that's true. My sister is like trying to like help me. You can see her. Chef buys a ton of games and doesn't play them. She's one of those gamers. It's because I get bored easily. I probably have ADHD. But you need a game which is different every time you play it, keep you engaged. Yeah, that would be nice. Have I heard of one actually? What? You say chess, I swear to God. Have you heard of Team? It's not. That's not different each time you play it though. It seems like very much the same thing every time. There's like 800 maps. 800? 9 classes, probably like 23,000 different ways to play those. And not to mention you're going up against people doing different stuff too. But you can say that about a lot of games. You can say that about Hades. Maybe that's why I like Hades. I needed new environments, new experiences, new. It's gonna be out for so long, but it's crazy in terms of what you run into. I don't know. I see new shit every time I play. I just don't think I would like it. Like I honestly like I don't know. It just doesn't interest me. Maybe I'm missing out. But maybe I'm judging a book by its cover, but it's just like it doesn't excite me. No, I thought it was what I thought it was more like Overwatch. I thought it was like you have like an objective and then like you have a team and then you complete that objective with the team using the different abilities. That's what I thought it was. But maybe I'm wrong. Yeah, it's kind of like Overwatch at a surface objective level. Uh-huh. I got bored of Overwatch after 2 or 3 times. I also, like, another thing is, like, aren't you on a team? I'm not good at teams. I don't do teams very well. Overwatch is very focused on the game. People are just focused on the humor. I guess. But, like, you guys think I'm funny? Probably not. I don't, like... I know that's not what you meant, but, like... yeah, like, me being on teams, not your humor. Yeah, I know that's not what you meant, but the game humor. I don't know. Teams make me intimidated. It's another form of social anxiety that I don't know if I'm willing to cross. There's no team expectation in TF2, actually. That's one of the best parts. What do you mean? Aren't you, like, in a team? Another round of Sika. I'm too stupid for it. I'm too stupid. It's too dumb. I'm too dumb. See, look at my score compared to the fucking top score. I'm too dumb. I don't know. I still don't really, like, have a hankering for TF2. One of the most common things in TF2 is friendly. Is a friendly where you just walk around handing food to people. Definitely not helping your team. Then what's the point? If no one's doing what they're supposed to be doing, then what's the point? Nobody minds. Why don't you just, like, play, like, what's, like, okay. If no one's doing the, like, the objective of the game, then, like, why don't they just play a different game? I guess it's, like, I guess they like the environment or whatever, or the community. There's a decent number of people doing what they should. I don't know. Like, role-playing and a little bit objective? I don't know. Oh my god, my knee. Hurting. Good. I don't want to be rude to you. Wait, what's up? Oh my god. I don't have access to that right now. I don't have any way of getting that right now. Sorry, not sorry. Haha. Concito Gobbler. It's the Concito Gobbler. I can eat a Hostess cupcake, but I don't really want to right now. I'd rather eat more taquitos, but I'm running out. You know what I should do? I should go to Target and get some wrapping paper. Or, like, the tissue paper. Because I have my Secret Santa gift in a paper bag, but it's just, like, sitting in there. I feel like it doesn't look good like that. I don't know. I'm a guy now? I'm the type of guy to trip on a branch in a horror movie? I'm not. What the? No. Okay, in horror situations, I freeze. I either freeze or I run to someone who I can hide behind. No other option. Jeff would be a freezer. I'm a freezer. I get scared, so I don't move. I would definitely die first in a horror movie. I already know. And I'm okay with that. I'm like borderline on the brink of death at all times anyway. Keeps cool under pressure. Ay. There's none, pretty sure. Yeah, it's like scary. I'm scared. I mean, like, it's hard to keep cool under pressure. That's a lot to ask. I keep cool under pressure? You do. You're just better than us. You're better than the rest of us. I can't do that. I mean, I keep cool under pressure like normal pressure, like pressure at your job or pressure at school or whatever. Like, I can keep cool under that kind of pressure. But not if it's like life or death, or like I feel like it feels like it's life or death, even if it's fake. You know? Like at a haunted house. I'm terrible in haunted houses. Don't want to be rude with Exelor. Oh my god, but oh no. What are you gonna say? No, I probably shouldn't say it. What? You can't do that. You never guess what I have. Is it a gancito on your desk right now? Is it a gancito? Don't want to create drama in the community. What are you talking about? Send a pic. Pics or it didn't happen. The cherry Dr. Pepper. Ooh, are those good? I don't think I've tried one. Wink, wink, wonk. Tricked ya. They're pretty good, ma? Maybe I should go to Target and get one. No, I've been trying to drink less of it. Debating what to do now. Should I keep streaming? Should I go to Target and get some gift wrap stuff, tissue papers, whatever? Should I stop streaming and be really lazy and read all day? But if I keep streaming, I don't know what I'm gonna do. Did I just go to Target? And I have to decide whether I want to shower first. Probably should. My hair is getting a little greasy. Shower, I hardly know her. Oh my god. I think I should... I think to... Let me check something. Okay. I don't know why I did that, but I'm kind of glad. If you take a shower, you should do an IRL stream, even if you go to Target. That sounds weird. That sounds weird, Exalor. You're weird. If I go to Target. I mean, Target. I was misinput. I'll believe you this time. But yeah, I don't know if I should do IRL stream at Target. I'm shy. You shouldn't. You shouldn't. It wasn't a misinput. What the heck? But it was a joke? Oh, okay. I was like, what the heck? Yeah, I think I'm gonna go to Target, guys, and I think I'm gonna shower first. So, yeah, I don't know. I was like, I wanted to stream my study session, but I didn't really have plans for what I was gonna do after, and I guess I just like. I'll see you guys maybe tomorrow. Maybe. Excuse me. I'm telling you. Programming idea sounded pretty good. No. You can find someone better than me. Very easily. So, don't worry about it. I will see you guys later. Better shredder. I have to pay people who are better? What the heck, man? No, I don't know, man. But anyway. Anyway, I'll see you guys later. I don't know when. LOL. LOL. Whew. Why are you LOLing so hard? Anyway. I'll see you guys maybe tomorrow, maybe not. If not, maybe Wednesday. Or maybe Tuesday, but in the afternoon. We'll see. Probably see you Tuesday. Okay? I'm probably gonna be too tired after work tomorrow to stream. But I am gonna study. So do not worry, I will study. Okay? So I'll see you guys later. Love you guys very much. Okay? Goodbye. Goodbye, guys. Goodbye. See ya. Goodbye.